Good day, dear students. In current lecture, we need to discuss anaerobic bacteria, anaerobic pathogens, and common classification is based on one main property. It is a production of spores. So all anaerobes are divided into two major groups: spore-forming and non-spore-forming anaerobic bacteria. It is important because of two main reasons. First of all, absolutely different ways of transmission of the diseases. Of course, bacteria which is performing can be easily transmitted even by air due to resistance of spores to oxygen, and different methods of cultivation and diagnosis of the diseases. In the first part of the lecture, we will discuss spore-forming clostridium. It is the main genus, the main representative of spore-forming bacteria. We have multiple species. You can see it on the slide, and we will discuss them later. Common properties for the whole genus is that bacteria are gram-positive, spore-forming, rod-shaped, and obligate anaerobic. In laboratory, it's better to increase CO2 amount in air. It will stimulate the growth of bacteria. And the key unique property of Clostridium, it is the spore. Spore in Clostridium is bigger than vegetative form of bacteria, and cells containing spores will have different appearance. That part of the cell containing spore, it can be center of the cell, terminal or subterminal location of spore. That part of the cell will be enlarged, and spore containing vegetative form will have unique shape enlarged in one end or in the center. And actually, we have again two terms of Clostridium: first name of the genus, and second description of the shape. So actually, any rod-shaped bacteria with the spore larger than vegetative form of bacteria can be named as a Clostridium shape. And usually it is described as a spindle shape or drumstick shape. Different species are described in different ways according to the location of spore. So first species I want to discuss is Clostridium perfringens. It is one of the most known Clostridium. It belongs to, or it identified as a part of normal flora in GIT of human and animals. And actually, spores of this species can be easily found in environmental objects, in dust particles, in air, in soil, and they are contaminating multiple surfaces, including food products and some medical instruments. And in previous history of medicine, a lot of diseases were related to surgical invasions, surgical procedures when poor aseptic techniques were available, or in war surgery when aseptic conditions are not possible by obvious reasons. So Clostridium perfringens is capsulated, non-motile, and can survive even in presence of oxygen desire-tolerant bacteria. So in slides, it is single rod-shaped bacteria can form some short chains. As you can see in the left picture, bacteria is quite large in size, have rounded ends, and easily identified by gram-positive result of that staining technique. The main property of any Clostridium, especially Clostridium perfringens, the main pathogenic property is production of toxins. And actually, Clostridium perfringens is the most toxigenic bacteria. It produces about 12 distant toxins, 4 major toxins, and 8 minor toxins, a lot of different enzymes. And according to a combination of toxin produced by Clostridium perfringens, it is divided into 5 major types, from A to E, and identification is usually done by biological method. Means you need to take susceptible animal, infect it with your clinical sample, and provide different type of antitoxic serum for different animal, and one animal which will survive receives the correct type of serum, and it is the type of Clostridium perfringens causing the disease. As you can see in that electron photo in the right part of the slide, spores are located subterminal and slightly changing the shape of bacteria. It's not so significant as for other species. So if we will describe toxins produced by Clostridium perfringens, again, we have major toxins. The first one is CPA, or major alpha toxin. It is identifiable in all 5 types of Clostridium perfringens. It is chromosome-borne toxin and always produced by any type of Clostridium perfringens strain. So enzymes have ability to break down membrane of cells, especially immune cells of human and animal, such as neutrophils. It can inhibit migration and inhibit maturation of the cells. And by multiple mechanisms, it can affect platelets, activity of the thrombocytes. And in general, effect of the toxin is manifested by creation of conditions with very poor oxygenation and poor blood circulation in tissues. It is impairment of immune response and poor viable functions of affected area. CPB, or major beta toxin, that toxin is targeted against endothelial cells and some neural cells. It can produce pores in the cell membrane and the cell wall of human cells, leading to breakdown of the cell and necrotizing of tissues. It is the toxin which was initially identified in different necrotizing diseases such as necrotizing enterocolitis. And toxin as well is one of the most potent and dangerous toxins produced by that species. CPE is a minor toxin. It is similar by effect with CPB toxin. It as well can produce pores in the cell membrane of human cells, and by some mechanism it can affect exchange of calcium and can cause food poisoning and different other types of diarrheal diseases. So if exchange of calcium will be affected significantly, that toxin can lead to death of the cells as well. ETX, or major epsilon toxin, initially was identified in the sheep and in cattle suffering from hemorrhagic enteritis. And it seems like the toxin is activated by different enteric enzymes and can initiate its activity only in intestine. But effect is not clearly studied and some points remains unclear. But it's looking like toxin can affect lamina propria in intestine, leading to serious edema, accumulation of fluids, swelling, and as well it was identified in kidneys and brains with the similar effect that can lead to serious systemic consequences. And the last major toxin is iota toxin, or ITX. It is a binary toxin, consists of two subunits. Structure is very similar to common biological toxins. A active subunit, B binding subunit. It can affect by complex mechanism cytoskeleton of cells and lead to depolymerization of it. Few more minor toxins which are important in pathogenesis of the diseases. One is NET-B. Again, it is initially was identified in birds, and activity of that or significance of that toxin in human pathology is not really clear, and still it was not linked to any disease in separate manner, but it have very high similarity, about 38% similarity with major toxin beta, and it can form pores in affected cells as well, and can lead to necrotizing of especially enterocytes. Sorry. So maybe the toxin have some effect in humans as well, but not enough studies are publicized till nowadays. And the last toxin, minor toxin, is perfringelizin O, or PFO. It is similar by effect. It have ability to form pores in affected cells. It can increase activity of alpha major toxin. And actually, if you remember that streptolizin O toxin produced by Streptococcus. So both toxins have high similarity, and actually a few other bacterial genus can produce similar toxins. And it's confirmed that those toxins can affect red blood cells, cause coagulative necrosis in tissues, And it's looking like toxins can have common origin initially because they're identified in different genuses but have very similar effect and similar structure. As well, bacteria can produce number of different enzymes. It is already known uraminidase and hemagglutinins, which can cause tissue damage and affect different types of blood cells. Uh, it is fibrinolysin and hemolysin enzymes, which can as well damage muscle tissues. They can cause hemolysis in affected area, leading to abnormal blood circulation and oxygenation of tissues. And it has several factors which can inhibit phagocytosis and activity of macrophages. So Clostridium perfringens in common can cause two main types of infections. It is wound infection known as a gas gangrene, and different infections of GIT such as food poisoning or necrotizing enteritis in human and animals both. And few accidental cases of extra GIT and extra wound infections were described, but they're really rare and looking like some abnormality. So first type of infection which is prevalent nowadays, it is a food poisoning caused by Clostridium perfringens. Initially, it is transmitted by alimentary way through improperly cooked or improperly stored food products. Usually, it is some type of food which is prepared in large amount and kept warm for prolonged time. Usually it is some institutes like schools, nursing homes, hospitals or other, or some events when catered food is prepared and kept for a long time. Any person can come and eat it for the whole time of event. So usually types of products which are associated with Clostridium perfringens food poisoning, it is different types of meat, maybe dried or pre-cooked food, gravies, and etc. Incubation period can last up to 1 day, but usually it is 8 to 12 hours. And main course have non-specific effect. It's manifested as a simple GIT infection with abdominal cramps, watery diarrhea, nausea and vomiting are usually absent. Fever as well is not typical for that disease. And disease is self-limited. Usually spontaneous convalescence occurred within 1 day after onset of the symptoms, but some common disorders of intestinal tract can be observed up to 2 weeks. So as far as disease caused by toxin which was produced and secreted by bacteria in food product, and usually in intestine bacteria itself is absent, of course antibiotics are not required and it is unnecessary measure. And oral rehydration, or if some duration of the disease is severe, then IV rehydration is quite sufficient to treat a disease. But main number of people will not even look for medical help because within 1 day they will have spontaneous recovery without any additional measures and other consequences. For diagnosis of disease, if it is required, especially if it is some kindergarten or school and it is attention of control organs, then of course confirmation of etiology will be obligate. And the main method is a rapid ELISA test. It is common enzyme-linked immunosorbent assay with pre-absorbed antibodies against Clostridium perfringens toxin, enterotoxin, and fecal specimen is required to perform the test. Few hours are enough to give a proper result. Second type of disease which is caused by Clostridium perfringens, it is a gas gangrene. That disease is more important, more dangerous, and more famous in medical facilities and medical community. As well, it is known as very severe, rapidly progressive infection of the wound with severe damage of muscles, severe damage of adipose tissue, which with the time will lead to common intoxication. And as we said already, the main symptom of that disease is accumulation of gas around the wound initially, then in the whole extremity. So actually, gas gangrene is polyetiological diseases, and multiple species of clostridium can cause that disease. And usually, disease have combined etiology, means several bacteria are identified in the wound at the same time. And besides clostridium, it can be association with streptococci or some other aerobic or facultative anaerobic flora. Disease is usually transmitted through wounds which have a very narrow channel and obstruction of tissues in the entry, such like gunshots or some wounds in during traffic accidents with some plastic and nails in constructory activity. So it should be deep and narrow wound. After wound is performed, the channel will be closed easily by collapsing of tissues, soft tissues, and bacteria inside the wound will have anaerobic conditions. Access of air is closed, or if it is gunshot wound, usually first medical help required to close the wound, and access of oxygen will be prevented by medical staff or some person providing medical help. And disease is extremely fast progressing. Usually within a few hours after the onset of the diseases, some first symptoms can be observed, and actually all symptoms are classified into two main stages. It is early stage and late stage. Early stage is also known as the local, and late stage is known as the general stage. At the first day of the disease, all symptoms will be located near the wound or around the wound. And in the late local stage, it can be it can involve some extremity or part of extremity. Usually, of course, disease will start with severe pain in the wound because of trauma initially. Later, tenderness will be observed because of gas accumulation. Uh, Huge accumulation of gas and secretion of different liquids by bacteria and damaged tissues will lead to rise of edema. Accumulation of gas will lead to tenderness of the tissues. It will compress and obstruct blood capillaries, blood oxygenation and blood circulation will be affected, and zone around the wound will become cyanotic, bluish in color, with decreased temperature. It will be cold, while usually wounds are hot and red. And with the time, some watery discharge will appear, and that symptom we call crepitation. It means that small bubbles of air will accumulate in the wound, and when you will perform palpation of the wound, you will press slightly on tissues. You will feel that sound. It's like a snow when you're trying to make a snowball. It's making that sound, and bubbles of air will break under the tissues, and you will hear and feel that crepitation symptom. It's very unique. If you will feel it once, you will remember. And discharge from the wound, and of course, if you will press on the wound channel, some bubbling will appear. Bubbles of gas will go out of the wound. They will have very evil odor. It's really smelling awful, and usually you can identify disease by production of bubbles and the evil smelling. It is very unique for Clostridium. One symptom which is described usually in war surgery, champagne symptom, it is when the wound, usually gunshot wounds, is closed with the bandages, while shattered person is uh, transported to hospital. To prevent bleeding and infection of the wound with the dust and dirty, wounds are usually closed with the bandages. And of course, when doctor and hospital will remove that bandage from the wound, huge accumulation of gas will make that sound like you opening the barrel of champagne. And usually the symptom is unique for gas gangrene. If you perform X-ray examination of affected extremity, in the next slide I will show you that picture. We have that filtry symptom. Accumulation of gas will give that unique appearance of muscles. Muscle fibers will be located separately, and a layer of gas is identified between fiber of muscles. and it's looking like a tree with the branches. So in the late local stage, symptoms will become worse, but they still will be located near the wound or around the wound. Skin will become blackened, discharge will become more profuse, more smelling, more awfully smelling. Affected person will lose sensitivity and affected extremity because of destruction, massive destruction of some central nerves, and blood oxygenation will be lost, muscles will be destroyed, so motility will be affected, and in the late stage lost. And of course, all symptoms such as tenderness, pain, edema, they will prevail on the whole extremity, and the whole part of the body can be involved. So usually it's looking like that, bluish or some violet extremity with the bubbles of blackened liquid. Uh, the whole extremity, as you can see, is enlarged in size, edematous, it's tender, and of course the state is very severe because infection can involve the whole body part, and later it can spread to systemic blood circulation and cause massive intoxication. So in the right part of the slide, it is a filtrate symptom. I'm not sure if you can see it good, but in the center, it is a black two bones, fibular bone, and you can see it as a dark strip. And between them and around them, it is a muscle tissue which is separated by accumulation of gas. It is enlarged like a bubble, and you can see small blackened strips and white strips between them. Blackened is a muscle tissue. It is separated by accumulation of gas, which looking like a transparent cavity here. And in some position, it's really looking like a filtrate. In the late stage, toxins produced by bacteria will be absorbed in the systemic blood circulation. It will lead to severe toxic symptoms such as increased blood rate, heart rate, increased fever. It will lead to hypoxia, of course, and people will have tachypnea. Common state will be affected. People can have different symptoms of brain abnormalities, agitation. They trying to run away, to shout, some abnormal activity. And of course, massive release of hemolytic toxins in the blood circulation will lead to severe anemia with jaundice, and kidneys will be affected. Blood capillaries, kidney capillaries will be obstructed, will lead to acute renal failure. And without proper treatment, usually those people will die in 2 to 3 days because of very fast and rapid rate of bacterial growth and production of multiple toxins. So to put the diagnosis, usually clinical symptomatics and history of corresponding wound is sufficient to give a diagnosis. But of course, to confirm, you still need to take some material. Usually it is a discharge from the wound or resected tissues during surgical cleaning of the wound. Again, we have that Kitarotsy medium or Robertson Cook meat broth medium. Now it is commercially available. It contains some pieces of biological tissues of some liver or meat and nutrient broth. So the tissue is required to consume oxygen, to absorb oxygen, which is diluted in broth and can penetrate from the air. And it is suitable for transportation as well as for cultivation of bacteria if other culture medium are not available. So to prevent the disease, usually non-specific surgical measures are sufficient. Of course, any wound should be cleaned properly if required. Surgical cleaning should be performed, washing with antiseptic solutions. Every gunshot or deep punctured wound should be provided with access of oxygen. It should not be closed. If it is some bleeding, then proper measures of prevention should be done, but don't close the wound. Always access of oxygen should be provided to inhibit growth of clostridium and to kill growing Clostridium. And antimicrobial treatment is extremely important in that case. Usually it is multiple antimicrobial treatment. Two antibiotics as minimum should be provided. It is a simple penicillin or metronidazole plus clindamycin. And of course, killing of bacteria is not sufficient to prevent complications of the disease. We should provide antitoxic therapy with anti-gas gangrene serum for those people to prevent systemic action of the toxin and to improve outcomes of local injury. So if person is delivered in severe condition in late stages, or if some treatment wasn't proper, or disease is still progressing, then amputations of extremity, partially or complete amputation is required to prevent toxic effects on the whole body, because it can be the last measure when the whole part of extremity is affected, muscles are destroyed, tissues are destroyed, and you will just have nothing to save. And amputation is the only measure to save the life of the patient. So if sample is delivered into laboratory and you need to cultivate Clostridium perfringens, you have two types of culture medium which is preferred for cultivation. The main culture medium for anaerobic bacteria is blood agar, and usually bacteria is growing good. Of course, you should put it in anaerobic condition, but culture medium is a regular one. Bacteria is growing much better at a temperature of 45 degrees Celsius. Doubling time is approximately 10 minutes. It means that in 1 hour, bacteria can multiply and give you 6 generations. If you will cultivate bacteria in blood agar, it is a unique property of Clostridium perfringens. It will have double hemolytic properties. As you can see on that picture, with the blood agar I marked with arrows, but still it's not very good seeing here. Around the colonies are white, large translucent, but around the colony it is darkened zone, it is a greenish hemolysis, alpha incomplete hemolysis, and around that zone you can see that complete hemolysis is observed. So two types are present here in the same bacteria because of different diffusion properties of toxins produced by Clostridium perfringens. And we have TSC agar, which is used for identification of Clostridium perfringens. It will grow as a black colony, and easy to identify that bacteria in the specific culture medium. For confirmation of etiology, we have that Nagler's reaction, or correct name is a lecitinase test. It is the test to identify alpha toxin produced by Clostridium perfringens, which have lecitinase activity. It's easy to identify in yolk egg agar, because naturally yolk egg contain a lot of lecithin, and test is quite easy to perform. You need to take a petri dish with that modified yolk agar, and split it into two parts. In one part you need to add antitoxin, and in another part nothing should be added. Inoculation should be done as a strip by the center of the agar, and after incubation, if it is Clostridium perfringens, it will release alpha toxin. Any type of Clostridium perfringens will release it, and naturally that toxin will cause deformation of lecithin structure, and opaque translucent zone will appear. It's looking like a white strip in the left part of the slide, and in the part of the petri dish, here it is the right part of the petri dish, where antitoxin was added. That antitoxin, of course, will neutralize the effect of the toxin, and lecithin will not be produced. You will see separate colonies without any changes around. So if inactivation of toxin occurred, it means that it is Clostridium perfringens. If as the result of the test you will have both parts of the petri dish containing opaque zone, or neither of them, then it's not a Clostridium perfringens, it's some other bacteria you need to identify more detailed. So Of course, for treatment and for prevention of complications, we have anti-gas gangrene serum, which is usually a cream and contain concentrated high amount of antitoxic immunoglobulins, which are obtained from horses hyperimmunized with antitoxin A of Clostridium perfringens and some other species. And of course, that serum is polyvalent and contain the main type of antibodies. It can be used for treatment of any type of Clostridium perfringens because any producing alpha toxin. So usually for treatment of disease, we using IV therapy to provide a systemic effect to prevent release of or prevent effect of the toxin on organs. And initially, if it is only the beginning of the disease and stage is early, intramuscular injection around the wound in affected area is sufficient while toxin is not absorbed in systemic blood circulation. You can provide it only intramuscular around site of injection of injury.